Hi, everyone. I am Jennifer McGowan, owner of Regenerate Physiotherapy, and today I have an awesome guest, our first guest, Angela Orenczak, owner of Inspired Motherhood, and she's a IBCLC, so Lactation Consultant, international board certified lactation consultant, childbirth educator, and also a postpartum doula. Today, we're just going to ask her more about her practice here south of Atlanta in Georgia and her story. She is someone I refer to often as health physical therapist. We get to see moms during their pregnancy and postpartum. And oftentimes I say, if baby's not feeding, you're not going to rest. So I send them on over to Angela. Thank you for joining me.
Sure.
I first ask you, my first question is, tell me a little bit of what inspired you to start I think you said you started as a doula. So tell us a little bit about your story and how you ended up to owning Inspired Motherhood.
Okay. Yeah. So I have five kiddos. My oldest is about to be 19. And I had hiccups with my first baby's feeding issues, and a chiropractor saved our breastfeeding relationship. And I'm very thankful for that. The Leche League was a huge part of my early motherhood. So the Leche League International, they have meetings for mothers, mother to mother support all over the world. And I happened to be in Savannah, Georgia, and I happened to be next to a really, really great active group. And so that kind of put me in contact with a lot of breastfeeding moms of all demographics, nursing 5-week-old babies like me, or breastfeeding gigantic 22-month-old toddlers with teeth, which just seemed so weird to me at the time. And I just fell in love with that group. And so I started the journey to become a Leche League leader. And I did that for 15 years and just supported moms, Henry County, Spalding County, sometimes in Peachtree City. And I loved it so much. I thought maybe I could do this for real, clinically. And so I decided to go down the path of becoming an IBCLC. It took me about 5 years to be ready to sit for the exam. So I did that in 2011. I was surprise pregnant with my fourth baby. And then at that time, I also became a postpartum doula. I did a course for that. And because I had little kids, I was very slow to start my practice. It was a very slow roll. I might have seen 1 or 2 people a month. But then as my kids got bigger, I was able to do more and take on more. And right before my last baby was born, I became a childbirth educator. And I just love being with families. I love the planning phase of birth. I love educating people during their pregnancy. I love helping them know physiological, normal processes for breastfeeding and for birth. And the more that you know, the more choice you have and the more empowered you can be in your choices. And I just love being a little tiny part of that for people, for their journey.
Mm-hmm. You became a postpartum doula first. Is that right? Is that what you did?
I started that process first in 2011-ish, right around the same time that I was going to sit for the IBCLC exam. So I did some postpartum doula work, but when I had that last baby threw me off when he came along 5.5 years later. Had to kind of put everything back on the back burner. So I don't do much postpartum doula work, but I do love it. I hope that when my kids are bigger, I can do more of that for people. It's very rewarding. It's so fun to go mother a mother and help her with all the little things while she can mother her baby. It's so special.
Mm-hmm. For those of people who aren't familiar with lactation consultants, can you tell us more about what that entails? What's your job description? What do you do?
Sure. So my load of clients is usually people who have been discharged from the hospital. So I'll see 2-ish day old babies all the way through weaning a toddler. So there's a wide range of moms and babies that I can help. A typical consultation is about 2 hours. It's pretty involved. I do a full history on mom. I want to know all about her medical history. We talk in depth about her birth. We talk a lot about her pregnancy. I do watch feedings happen, but that's such a tiny little part of what I do. I think people come to my my office and they think she's going to watch me feed this baby. And I do, but I just kind of peek and look. And if there's things we can tweak, we tweak them. But there's so much more to lactation than just a latch. And I think that's, people get hung up on that. Oh, I have a shallow latch, or my latch isn't good, or my latch is good, but my baby's not gaining weight. There's a lot more to it than how it looks. And then I usually do an oral exam on the baby to check for function, to see how's their suck, what does their palate feel like, are their lips flanging, are they clicking, how does their tongue function, what do their frenulums look like. And then at the end of the consultation, we kind of tie it all together with a temporary care plan to say, okay, if there are urgent needs, these are the 3 things you're going to work on right now, and put things in place. And it's always movable. I tell people, if I give you a care plan and you get home and the wheels fall off, call me, we'll rework it. But a consultation is about 2 hours long, and it's very intense. A lot of information is exchanged. So they're, depending on the baby's needs and the mother's needs. If the mother is in pain, that's its own level of distress for a family. If the baby is not gaining weight, that's another level of distress. If a baby's not latching, it all kind of just depends case by case. That's why it's so specialized. Each visit is so special and specific to what they need.
When do you feel is the best time for mom to reach out? I mentioned earlier, like prenatally or postpartum. I know I tell people to put your phone number into their phone because if you're breastfeeding and having an emergency, I remember like crying in the middle of the night because it's so hard. It's so hard. So what do you recommend? What's the best time to seek your help?
If I could wave my magical wand, I would say, call me when you're pregnant, please. Like, let's do this early. First of all, it gives us a friendship. You know, we have this relationship to go into this journey together. I'm not just some weird lady that maybe you might call maybe to come look at your boobs when your baby's here. That seems very strange to people. I think that's weird. I was very weirded out by the thought of that myself. But if I knew going in, oh, it's just her, she's fine. Like, I am a little weird, but I'm not that weird. So prenatally, I have been getting, just in the last probably 2 to 3 months, so many prenatal calls. I have been so happy because it really sets us up for a good experience. Even if you run into problems, even if the wheels fall off, at least you know, I've already got your history. We've already met. I already know half your story. So prenatally, yes. And then if you can't, I have had people run out of time. Like they won't think about it till they're 37 weeks. And then they're suddenly, they have a scheduled birth happening. And they're like, I can't fit it in. It's okay if we can't meet prenatally. Just as soon as you're feeling pain, or if there's any signs that the baby's not gaining weight or not pooping, that's a perfect time to call. If you delay and wait, you get yourself into more trouble the more days that go by.
That sounds great. I have 2 questions. The first is, when in pregnancy would you, last trimester, or is there a certain time? Okay.
Yeah, I think, if you have no risk for preterm labor, 35-ish weeks is a good time kind of for everybody. That way we can do the history, get to know each other. And I do give care plans at the time of the prenatal so that I can really set you up for, if you have a baby that goes to the NICU, this is what we're going to do. If you have a baby who needs respiration help, this is what's going to happen. If you have mother-baby separation, if you end up in like needing an ICU kind of situation, I can kind of cover those bases. And I don't mean to fearmonger, but that's life. That happens sometimes. That way you have a plan, because it can become very panicky when you have no plan and you just thought the baby's going to come out and go right on my chest and everything will be great. And it does happen like that most of the time. But if you're in the small percent where it doesn't happen, and I give tools in my prenatals too. I give everybody some tools to have that I tell you, pack these in your hospital bag, because these can save night 1, night 2 of distress. If you have these things, they're really great tools to have.
That's great. I'm like, dang, I wish I did that.
Yeah.
We just kind of, a lot of people and I gave birth initially in the Midwest, but I think it's similar to down here, but you just kind of jump in, and I read What to Expect When You're Expecting.
Mm-hmm.
And then that's really it. And then a
Yeah.
lactation consultant comes in the hospital, and then you leave, and
Right.
it's feeling very unsupported.
Yeah.
What are some, so that leads me to my second question. What are some signs or symptoms of baby or mom that maybe you need a lactation consultant?
It's a long list.
Yeah.
So, right away, painful nipples, nipples that have blisters, babies that will not latch, a huge weight loss in the first day or two. Usually 8 to 10% is normal. If you're getting into that 12% or more range, that's emergent. Like that needs to be helped and handled right away. Longer term, when you get home, babies that are very gassy, babies that seem uncomfortable. I see a lot of grumpy babies. They just are uncomfortable for lots of reasons. Birth is hard on babies. And so sometimes they just need a little extra help, and it's not doom and gloom. If you have sore nipples in a baby who's not gaining weight, we can fix that pretty typically. People who think they may have a low milk supply, I usually call that perceived low milk supply because most of the time people make enough milk, but there are times that there are medical indications that a mom might not make enough milk, and we need to know that right away too. So supplementing can start. So those are kind of the big ones.
That made me think about people that can't see how much milk is coming out. And then you see your pediatrician, it starts once, if baby's healthy, you start once a month, then every other month.
Yeah.
And you feel like you're not getting enough milk, and baby can be grumpy or upset. What's a good way to know that I have parents in here who get pretty nervous. Baby's still growing, but the baby's upset. So maybe they think they're not getting enough milk in. So is that, obvious reason to see a lactation consultant, but maybe some ways to ease mom a little bit in that moment.
Yeah, I think I tell a lot of people, I get a lot of phone calls during the 3-week growth spurt and the 6-week growth spurt. Everybody kind of thinks their milk has magically disappeared because their baby acts a little foolish during those, little chunks of time. And very typically it's biologically normal. This is a part of lactation that just happens. So if a way to ease your mind is the baby pooping? That's a huge indicator of milk transfer, and that's an easy one. There are a lot of people who their pediatricians will say, it's fine if the baby's not pooping, it's fine. Well, then we're seeing the babies dropping in percentile, and they're unsatisfied, and they're always kind of fussy or colicky or whatever. So poop is a big indicator. And then other little things are they outgrowing their diapers? Are they outgrowing their onesies? I know that seems very silly, but you don't have to have a scale to tell that your baby's growing. You can see it. I have vivid memories of trying to snap a onesie on my kids and going, this fit last week.
Yeah,
and there are definitely families, moms and or dads. I've had dads too that just have a lot of anxiety surrounding infant feeding because maybe something happened in their family, or maybe they had a rough birth, or maybe they had a tough start. It's okay to go do weight checks. That's totally acceptable to say to your pediatrician, hey, we don't really need a well visit, but we'd like to pop in for a weight check, because if your baby's not gaining an ounce a day early on, that's the time to catch it. And the thing, like you mentioned, the well checks with the pediatricians, pretty typically you do that one when you kind of come out of the hospital, week 1, and then you're maybe going back week 2, maybe for a weight check or a well check. And then you're kind of dismissed for 2 whole weeks. Well, a lot can happen in 2 weeks before you get to that 1 month. And that's a lot of times when I'll see people calling me at the 1 month well check saying, my baby still isn't to birth weight and we didn't know. And it's not their fault. They thought the baby was doing okay, and then they find out that they're not. So I like a 2-week weight check a lot. And then I do, if there's question about if the baby's gaining, just call and ask the pediatrician. You're paying them for these services. You can just say, we're coming in, we want a weight check. And what are they going to say,
Yeah. Why the 2-week check? Why is that important?
Because if you get dismissed from your pediatrician at 1 week and you're not seeing them until 1 month, a lot can happen in 3 weeks. And I think most of our local pediatricians do a 2 week check, which I just so think is so helpful and important. Probably 8 to 10 years ago, that was not the case. And so pediatricians were seeing kids, day 5 and then not again until they were a month old.
Yeah.
There is so much that can go wrong in 3 weeks, or you're just not being cared for and nobody's really got their eyes on the mom either. We're not asking the mom, how are you? Are you feeling okay? How are your breasts? How are your nipples? I mean, I know that's not really a pediatrician's place to do that, but if you're in charge of infant feeding, somebody should be asking these questions.
Yeah, and that's where the World Health Organization recommends, I think, 5 visits within 3 weeks of mom giving birth. And I think what's also beneficial of seeing support, even for feeding for someone like you, is that I know you personally, but I also know you're asking about the well-being of mom because we treat people postpartum and prenataling here. But if mom's unsettled in this session or she's having pain, we can often tell baby mom relationship too. So I think, is that something that you do? You're checking into their breasts, but I'm sure you're asking about other things. Is there something you do for them?
Yeah, I'm a little bit nosy, maybe. I don't know, but it's in my intake. I want to know, how was your birth? How long did you push for? Do you have stitches? Did you tear? How are you feeling? How's your bleeding? Do you have big clots? These are things that are not being asked of these people for many, many. I mean, who cares once you get to your 6 week well check, postpartum check? What difference does it make at that point? If it, day 10 postpartum, you're passing giant clots and you're feeling like crap and your stitches are hurting. Somebody needs to be asking these things. And I'm not treating that, but I can at least go, you need to call your provider today. Like this, you cannot go on like that. I also asked, I had a client recently who shared some intimate details about bathroom things. And I said, you need a pelvic floor therapist. She can change your life. And she had never even heard of that. She didn't even know that was like a thing. And I said, I'm going to tell you, you may go for your 6 week check postpartum and tell them about it, but they may not even know what to do about it or send you in the right direction. So I check on everybody. I want to know, do you have help? Is your partner off from work? Do you have family coming to help you? Do you have a friend network? Do you have a church network? Do you have people bringing you food? I ask all those things because I want to know, what does life look like for you for the next 2 weeks? Because having especially your first baby is so overwhelming. You just don't know what to expect. And if you are fully unsupported, it's not a good place to be. And so I probably overly check on some of my people, how's it going today? How's feeding going? Any challenges? Hopefully they're not too bothered by my texting them. But I think mostly they're relieved, like, oh, somebody out there is checking on me, because I feel like in our country, mothers are not well cared for. So I try to bridge that gap a little bit. And really, I have no shame in telling people, call your provider now. This needs to be addressed. And if I'm wrong, I'm wrong. If you make a phone call that didn't need to be made, whatever, but I'd rather you make the phone call than just go about life like everything's fine when it's falling apart.
Yeah. That takes me to another thing, as I have moms who are bottle feeding babies and they come to our sessions, but you can tell baby's still really uncomfortable. And so often I am still referring to you, our lactation consultant. Even if baby's on bottle, can you explain more about how you help moms that are bottle feeding babies?
Yeah, absolutely. So, some bottle feeding moms are still pumping, and that's still breastfeeding if they're still providing their milk, or if a mom is fully using formula, it's still infant feeding. It's still a specialty that lactation consultants can help with. I have a lot of bottle feeding tips and tricks and methods and things that can be shared. I've helped with bottle refusal, bottle aversion, moms that maybe delayed the bottle too long because they need to go back to work, but that's hard. It's hard to do. Helping moms be able to go back to work. And if a baby is bottle feeding with poor function, it's still about the infant's function. It doesn't matter if it's a breast or a bottle. I can still do an assessment on a baby and say, I don't diagnose anything, but I can say, I see this and this and this and this. This leads me to believe that these are the reasons that you're struggling. Here is how we can help you, and still create a care plan and still help the baby. The only thing with bottle appointments are if the mom is not lactating, if she's not still pumping, I might have a harder time getting it covered under insurance. So there is a little thing at play with that. But sometimes you can still, depending on the insurance, you can still have the baby covered because it's still infant feeding. So that's the only difference. I'm not able to help everybody with insurance coverage if they are not lactating, which that's stupid, but it is what it is.
And insurance is ever changing, but I think
Yeah.
more or less, like in my brain, I was put lactation consultant was with breastfeeding, and I
Yeah.
don't, and I breastfed, but then I had 3 out of 4 babies not want to take their bottles.
Yeah.
And I was in my, my youngest are only 7, so it wasn't even that long ago, but like we just, we push through so hard as moms, and to what sacrifice, you push through, and then I'm taking 7+ years to recover from just,
Right.
them not wanting to have a bottle. I worked, which is hard on the whole family, my spouse, the siblings, and all of that. So I don't know where that comes across, but I'm so grateful that you help people with bottles.
Yeah, totally.
So, and then just bridging the gap, because I think there just isn't great postpartum care in our country. There just isn't. As far as lactation consultant in your practice, if you could share a little bit more about where you're located, as well as what's going on currently in your practice, and then do you have any goals or vision for the next year to 5 years?
Okay. Yeah. So I am hitting my 13-year anniversary of being an IBCLC. So that feels kind of monumental. It feels good. I've been in practice like officially 10 years. So that's a milestone that feels good. I'm currently in the Brainery office in Peachtree City with Dr. Samantha Brooks. And so she has a great, beautiful setup for me. I have my own little room, and I see people. I'm very flexible in my schedule because feeding issues are so urgent and they're all very last minute. So sometimes I see people that day if it's doable. I try to see people really quickly, though, within 1 to 3 days. I will see people on the weekends because if your baby's not eating, it's kind of a big deal. So I try to be as flexible as I can while also still having balance for my own life. I have 5 kids. I homeschool. I am married. I have other things that I do in this world. And yeah, that's kind of where I am right now. I do still do some home visits. So if somebody is very early postpartum, or if they came home with a catheter, or they came home after a massive hemorrhage and they just can't leave their house, I will go to their house. I still have that as an option for people too. I just try to limit it to people who have like excessive medical needs.
Yeah, maybe twins. No, I'm just joking.
Yeah, I would go home. The twins are a lot.
Yeah. As far as your practice right now, it's just you in the practice?
It's just me. I've had a contracted employee before. I'm talking to somebody now, so maybe she can fill in on the days that there are days I don't want to work because of other obligations. So I may have someone else join me this year, which would be really fun. Also, I don't really get sick that often, but I did have the flu the end of January, and I kept pushing people back, and I felt so guilty and overwhelmed and they were all fine. Like everybody's okay. But it would have been nice to have somebody to say, I'm so sick, go take care of them, to know that she could have. So yeah, it's just me for now.
And do you go to hospitals all to see people, or not so much when they come
No,
out?
it's very fuzzy on that, because if the hospital's charging lactation codes on that day, I cannot also do that because you can only have one encounter per day. So I don't go to hospitals. I've never worked in a hospital. I've always just been private practice. So, everybody has their own skill set. And I love my hospital practitioners. They're wonderful and they do their job very well in the hospital setting. And my thing definitely is more once they get home, helping with the long-term feeding goals and things like that.
I got a few more questions. I was also thinking about the range of which you see babies, and I think off in my brain, lactation consultants are like right away, right? The first 3 months.
Yep.
But if you could tell us a little bit more how you help the older infant and even toddlers, it'd be nice to hear too.
This week, actually, I'm working with somebody who has twin toddlers that she's working gently to wean and contacted me. She was a client, 2 years ago, and she said, okay, I'm out of ideas. I need your help. So, those end up being more almost like Leche League calls because I just can brainstorm with a parent. Everybody's life is different. Everybody's family dynamic is different, but I love weaning consults. Being able to gently wean is very important to me as who I am as a person. And also it's a tenet of Leche League that you wean gently with love. There are definitely times that though I've had to help people wean in one day because they have to start chemotherapy and that happens. And that's very difficult, but it's got to be done. And so it can look very different, but if you have time and it's not a medical emergency, weaning consults are great. I have one right now dealing with nursing strikes. Her baby's a little bit older and is refusing the breast in little bouts, and we're trying to figure that out. I have helped with the bottle refusal with the older babies too. And teething is another one I get a lot of fighting. That's unpleasant, but the older kiddos, that's the sort of stuff that I typically help with.
I'm laughing because I breastfed my twins till about 18 months, but we stopped because they were fighting.
Oh yeah.
At my breast. I'm like, we cannot.
No.
That's helpful. Also, I'm thinking of like clogged ducts I've like mastitis and clogged ducts. I've heard that a lot with my clients. I had mastitis a few times. Are there some tips to try to avoid clogged ducts, or is that just you're going to get them because genetics?
There are some things that you can do, but then some people are prone to have them because they have lots of inflammation in their body, or they slept weird, or they wore a bra that was old and it was too tight and they shouldn't have worn it. Always moving the milk, like perpetually always removing the milk is really the best way to keep from getting a clog. Some people, I would say most people never get a clog. There's the subset that will get mastitis once and never again. And then there's some people that get it recurrently. It's luck of the draw, unfortunately, for that. I will say there's a new ABM protocol that came out the end of last year, I think. It may have been the end of 2022 that has a new protocol for mastitis. And so something I'm trying to share with a lot of people is do not do aggressive massage of your breasts if they are infected. That was the thing for a long time, was like, stick your thumb in there and push and rub. And it's so bad for you. It just makes the infection worse. It keeps it inflamed and your breast can't do the work to get the infection cleared if you're messing with it all the time. So the new protocol is very good. Ice, anti-inflammatory, removing the milk perpetually. Don't stop. People think, oh, I have an infection. This milk is bad. It's not bad. Keep moving the milk. Yeah.
Yeah, I went to the emergency room with the twins and I knew I had mastitis, but the nurse in the emergency room was telling me not to breastfeed off of that breast. And I'm like, I had 2 babies. I'm like, well, we're going to.
Yeah.
I don't know where some of those myths come from. I think it's ancient, but what was the name of the protocol again that you said?
The ABM protocol is the Academy of Breastfeeding Medicine protocol for mastitis. They just updated it. I actually I pulled it up yesterday for a client just to kind of refresh myself and see. And there are things that are newer in the last 5 years, like ultrasound therapy. If somebody has recurrent mastitis or clogs, ultrasound therapy has shown to be very effective in preventing them in the future. I've sent a few clients for that just, they couldn't stop the cycle of the clogs and they were just sick all the time and getting mastitis all the time. But, that's rare. That's not a common thing, but
Yeah.
it's good to know how to treat it if it comes up for sure.
Yeah. Um, one, okay, one last clinical question, then I'll ask you a few other personal ones.
Sure.
Tongue ties is a big thing that's changed, I know, since having my twins 7 years ago.
Hmm.
Um, and I'm like, man, I think some of my kids had a tongue tie.
Mm,
Uh, but I was at the pediatrician and like they were like,
right.
it's fine. And so again, I just pushed through.
Sure.
Um, how are you screening? Is it common, first of all, is it common for a parent to come to you with the diagnosis, or do you feel like you're having to refer out to get that treated?
Um, the thorn in my side is infants that are having feeding problems. And they aren't gaining weight, they aren't latching well, they're very sleepy, long feeds that take 45 minutes to an hour. And everyone who has seen that baby says, your baby's fine. They have no tongue tie. So the parents come to me going, they don't have a tongue tie. And I do my exam and I'm like, I think you need to go see someone for a tongue tie. I would say most of my people come not knowing that their babies are restricted. I'm only seeing people that have problems too. So
Yeah.
my client load, tons of them have restrictions. Um, I don't see normal baby normally feeding. I'm not having problems. Nobody says everything's great. I'm going to come look at my baby.
Mhm.
So, yeah, it's a hot topic for sure. We're learning more every year. I do a lot of education for myself on tongue ties, on the protocols, on the stretches, on the exercises, on what can we do better? How can we manage this better? What is appropriate treatment? When do we wait? I mean, nobody wants to send a baby to go have a procedure done. That's an
Yeah.
unpleasant thing. So I try to be very cautious, but I also don't want to delay so long that you run into more problems. I mean, I've had people come to me when their babies are down in the fifth to second percentile and they didn't have any answer for months and months. And then suddenly I'm like, I think this is the problem. And then we can help them. But it's like, why didn't anybody catch this before? So I will say most pediatricians, most people that are seeing babies are not doing functional oral exams on babies like I do. So when I do my exam, the parents are always very like saucer eyed, like, nobody's done that to our baby yet. And this is like a 6 week old who's struggling to gain, a half an ounce a day. They're gaining half of what they should and they're dropping rapidly in percentiles. Like, why did it take 6 weeks to get to this point? So I see a lot of it. I have fantastic providers I refer to. They actually do the diagnosing. I love body workers for babies that have a lot of tension. So I have great chiropractors, CST, myofascial release therapists. I teach a little bit of, infant, just facial massage and do this particular tummy time exercise with your baby. There's other things that go into it. But yeah, I see it a lot. And I think it's sadly missed in early feeding issues, so much so that I have a number of people who will just cry in my office because they finally have an answer and they've been ignored for weeks and weeks at that point.
What providers correct tongue ties? What's their profession?
I use dentists. I have a pediatric dentist that I love. I do have a pediatrician who's also an IBCLC like me, who is fantastic. He is the chattiest, most fun human ever. And he very much looks at mothers and babies as a pair, like I do. He sees the big picture of everything. And then I have one ENT that I really like, who he's been my buddy for 15 or 16 years. I've been sending babies to him a long time. So it's varied. And also I have the talk with parents about, can you cash pay this? Do you need to use insurance? What is going to be affordable to you? I don't know people's finances, and it definitely comes into play in that conversation because you want everybody to have access to these providers, but sometimes it feels out of reach if you don't have an extra, $1,000 in your bank account, which a lot of people, let's be really honest, groceries are expensive. Life is expensive right now. They might not. So I try to be creative with which provider I kind of send people to. But if they're on my list, I love them and I have respect for them and they do a great job. So I can usually help most people that have babies that have restrictions, even if they aren't going to be able to cash pay for a release.
Yeah. Yeah. So you said ENT, so ear, nose, and throat doctor, as well as pediatric dentists.
Mm-hmm.
Some pediatricians, if they have the training, do they do them?
Just one. I have one on my list. Yeah.
And then as far as you said chiropractic care, and then CST is cranial sacral therapy
Yep.
and massage therapy. There are pediatric physical therapists that can do it too. It just depends on the area that you're in.
Yeah.
So,
And I do have one occupational therapist who is
yeah,
worth her weight in gold. She's so
yeah,
fabulous that if I have a really tricky baby, I'll recommend that the parents go see her. It's a bit of a trek from the South Side, and it's, you know, financial investment too. But if your goal is to have a baby that has good function, who can eat well, who will benefit from all of this work we do in infants, which I just really believe they do. I think if you are treating a baby in infancy, addressing their tension, addressing their frenulum, helping them to reach their potential to make feeding really, really functioning and perfect, they're going to go into toddlerhood better. They're going to go into school doing better. I know that's a theory. I can't
yeah,
bank on that. I don't have evidence to say that, but how could it not? How could you not have these kids that were struggling and tight and tense? And, you know, some little babies that I lay down to when I do their exam, they go in a little C shape. Their little body is so tense, it's just completely pulled and, you know, an angle. Or torticollis, you know, babies spend a lot of time with their chin on their chest. And I'll usually ask the dad, if the mom's there by herself, I'll be like, on your phone, if you scroll all your baby pictures, is your baby always looking to the right? Yeah, they are. Okay, we need to work on that. But who else is seeing that? You know, I don't know. And I love body workers. I do. I'm completely sold out biased to body workers. I think they're so fantastic. Our whole family has been chiropractor people for 16 years. We love them.
yeah. Thank you for sharing all of this. I think very valuable information. I think you do so much more than maybe I thought. What IBCLCs do in general lactation consultants, and again, a lot of it is just my oldest is 12, so just a guessing game because I was no matter what state I gave birth in,
Sure.
I had to guess at what people did, and thankfully there's more online resources. I know you have social media account. What is the name of it? And I'll put it in the
Um,
notes below.
the Instagram is Inspired Mothers Lactation, and I'm a great content creator, but I try to share things that I love. Sometimes,
So they can follow you on there or get a hold of you. What's the best way to get a hold of you?
honestly, texting, and it's on my website. So if somebody Googles Inspired Motherhood, I'll pop up. Or in our area, if they just Google lactation consultant near me, I'm usually near the top of the list. They can text me. I usually book that way because I have a crazy life with a bunch of wild children. But I am in my office usually 3 days a week and weekends if need be. Like I'm seeing somebody Saturday just because we couldn't make it work this week,
Yeah.
but very flexible and always glad to help people. I mean, I want to help all the moms and babies. I want everybody to be happy.
It's been great getting to know a little bit more about what you do. Thank you for your time. Before we get off, is there any advice that you would give a mom that is maybe feeling lonely or lack of resources? Any advice that you would give a mom out there reading or listening to this?
Yes, I was that mom. I was at a Leche League meeting with my first baby, and we broke off into little groups. There were probably 20 of us, and we broke into like groups of 4 or 5. And every other mom in my little group had a newborn, my same age-ish, and then like a 2-year-old. And I just opened up to them. I don't know these people at all, but I just said, I am really lonely. I feel like I wake up, I make breakfast for me, I feed the baby, I give the baby a bath, I read to him, we play on the floor. It's only 9:30. What the hell am I going to do with the rest of my day? And they were the sweetest, kindest group of people. I left with everybody's phone number. We all started meeting at the park multiple times a week. They were my lifeline when I had one. And I think back to those days in Savannah, we were only there a year. It's where I became a mom. sweetest times of my life, the best people ever. You have to find your tribe. And I know
Mhm.
that's so cliche and it's so annoying if you don't know how to do it.
Mhm.
Find your people, ask people, talk to people. If you're at Starbucks and you see a mom with a baby the same age, just talk to her. Just say, hey, your baby's so cute. Open that line of communication, but finding someone, find your people. I host a free breastfeeding support group once a month. My hope of hopes is that people will come there and find their people. I know that the different other of our buddies all kind of have different support groups going on. Don't be so proud that you won't go. Don't be so shy and introverted. I'm a huge introvert. It takes a lot for me to like speak to people, a lot, but I was so lonely. And once I connected, once I found the Leche League, which was huge, I, I got in with a group of really great moms. We are still friends. Our babies are turning 19 and we still talk. We are still buddies. They were amazing to me. And I think just getting out of your house, go for a walk, get in the sunshine, take your baby to the park, go push them in a swing. You will find other people just like you that are lonely, and you can make those connections that way. It's funny when I host moms night ins at my house with my friends, 99% of them came from La Leche League. My friends that I currently have today, right now, they came from La Leche League connections. And that's so silly. It's just mother to mother breastfeeding support. Who knew? But not just staying home and sulking and thinking, I can't. And I get it. Like, we didn't have money when I had my first baby. I wasn't out like getting Starbucks every day. I couldn't afford that. But I could afford to go push my baby around the neighborhood and go to the little park, and I could go push him in a swing, and that didn't cost me anything.
Mhm.
So, not to be preachy, but get out of your house. I think that's like step one. You can't meet new people in your own living room.
Yeah, this is
Yeah.
true.
Yep.
That's great. Thank you so much for your time. I really appreciate it. And I will definitely put all your contact information here below the video. And then I know you mentioned a few things, so I might ask you for those resources later. But
Sounds
thank
good.
you. I
Yeah.
appreciate it.
Bye.
Bye.